So good evening, everyone. Today's session is going to be on counseling. We are going to have an overview of what counseling is, how it's done. Then we will go through some common topics, that get asked in the exam, and we'll go about these topics briefly. So, by way of introduction, what really is counseling? Counseling really is a process whereby you have a trained counselor who is competent, who is there to help an individual that's in help or seeking help in gaining greater understanding of that person's self, and then help that person in improving his decision-making skills, and also make some behavioral changes where necessary, and to overcome his or her problem. So, of course, in the exam, you are not a trained or professional counselor, but they expect you to do at least the very best that you can do in counseling that patient, making the patient understand what is going on, and provide the patient with the appropriate information that the patient needs in order to make the right decision regarding the problem that had been presented to you. So it's a process actually. The counseling is a process, and then it has different stages. So you have the first stage of relationship building, because it's just like strangers meeting. So you have to build a relationship with that patient. And by building this relationship, this includes you introducing yourself, asking the patient, creating that rapport with the patient. This is all part of building a relationship with the patient, such that the patient gains trust and confidence that, okay, I can tell this doctor my problem, and I'm sure this doctor is going to help me. Then the next step is making an assessment and diagnosis. You listen to the patient, okay, what is happening? And then he tells you this is what has been happening. So you assess the situation and you see, okay, what exactly is the main problem? You come up with the diagnosis. Mostly in exam, they have already given you the diagnosis, but still you have to make sure that you show them, okay, this is how it is done. Even though they have given you, you still go with how it is actually done. Then after you assess and make a diagnosis, then you formulate your goal. Okay, what is the goal? Is this something that is treatable? Is this something that we can cure completely? How are we going to go about it? These are all things that you have to consider while you are going to counsel the patient. Then intervention and problem solving. So when you formulate your goal, okay, is it something that we are going to cure? If it is something that can be cured completely, then okay, you tell the patient what interventions are available and which ones have higher success rate and which ones has lesser success rate, and things like that. Then you help the patient in solving that problem. Then the last step is termination and follow-up. You explain everything to the patient. You give all the necessary information. You give the necessary advice. You make sure that that patient has understood all that you have said. You address all his concerns and misconceptions. Then, of course, you give the patient an appointment for follow-up when that patient is supposed to come back and see you, or maybe see someone else, but still you give that patient the opportunity to come back when that patient has any question or any concern, that patient can always come back to the hospital. So mostly when it comes to counseling, there are two approaches that have been used. There's the spikes approach and the gather approach. The spikes approach is mostly being used when you are breaking a bad news to a patient. And then the gather approach flows more with counseling a patient regarding a certain condition. So see, the gather approach. This is the most common one, like I mentioned, that is being used for counseling a patient. So of course, the gather is a mnemonic where the G stands for greeting. For greeting, in this instance, you have an examiner and a patient. So you greet your patient, you greet the examiner, "Good morning, sir," and you greet the patient too, "Good morning, sir," or "Good morning, ma," depending on the gender of the patient. Then you introduce yourself. "My name is Dr. Aisha. My name is Dr. Fatima. My name is Abdullahi. My name is Nuruddin." Whatever your name is, you introduce yourself. "My name is Dr. Aisha. I'm a candidate of this exam." Then you seek for permission or you take consent. And by taking consent, you have to make it flow. So you have already greeted the examiner, you've greeted the patient, you've introduced yourself. Then when it comes to asking for permission, you say, "I'm a candidate for this exam. And for the purpose of this exam, I've been asked to counsel you regarding what brought you to the hospital. Please, may I proceed? Or please, do I have your permission to continue? Please, may I carry on?" Things like that. Then, other than that, after you seek for permission, you have to assure the patient, because it might be a sensitive matter. So you have to make sure that you inform the patient that whatever you discuss with him or her is going to remain confidential. You are not going to disclose that patient's personal problem to anyone, especially maybe when patient is admitted. You are having a one-on-one discussion with that patient. So you have to assure the patient that, okay, we are not going to tell all this information that you are telling us to your family or to relatives. We are not going to tell them unless you give us permission or you decide to tell them by yourself. So this is all part of building trust. And then the setting, of course, the setting is mostly about the environment. So these are all things that you do in order to create rapport with the patient. So this are in certain, this is a situation whereby you ask, "Okay, sir, ma, please, what is your preferred language? Will you like me to speak to you in English, or would you like to speak in any native language?" But of course, it's exam. You know that you have to speak in English, but there is no harm in asking. You can ask, "Can I speak to you in English, or which other language would you prefer? Is it okay if I speak in English, or would you prefer me I speak in Hausa or any other language?" And then you go ahead and ask, "Ma, please, are you comfortable here? Would you like someone to be with you, like a family member? Are you okay? Would you like a cup of tea? Would you like to drink water? Would you want to have a tissue?" Things like that. Is the environment okay for you? Would you like to change anything? Maybe there's AC on. So you ask, maybe the patient is feeling very cold while you are not feeling cold. So you ask, "Is it okay? Would you like me to reduce the fan? Would you like me to switch off the AC?" This is all part of building rapport with the patient, such that the patient feels gives you all their trust, such that they know that, okay, I can talk to this doctor, it's okay. That is about the G. Then for A, this is where you ask the patient, "Okay, ma, what seems to be the problem? What is happening?" Of course, they might have kept it already on the table that you are counseling this patient for so, but still you ask the patient, "What is the problem?" Then they tell you, "Okay, this is what they told me." Then you ask, assuming they said, assuming maybe it's you are counseling this patient for smoking cessation, or let's say maybe immunization. So you ask, and she tells you, "Okay, I am here to ask, because I was referred here because I refused to give my child for immunization." So wait, this is you asking her. After you ask her, then you, "Okay, ma, why don't you want your child to be immunized?" Then she tells you her reason. No, doctor, the first I have seen my neighbor, each time she takes her child for immunization, the child becomes irritable, he cries all day, or maybe he gets sick with fever, all sorts of problems. She will tell you why, she will tell you her reason why she's refusing the immunization. Then you tell her, she has told you everything why she's refusing, and then you've also asked her, okay, what do you think immunization is, why are you refusing it, what do you think the benefits of immunization are? She might know, she might not know. Then for T, where you tell her, this is where you tell her everything. Then in this A, she might have told you so many things that are actually not true. So in telling her is where you clarify all her doubts, you clear all misconceptions, then you tell her everything about that thing that you are about to counsel her. Then after you tell her everything, then there comes the help. You help her. You help her address her concerns, help her decide, make the right decision, and help her with any other concerns that she might have. Then for E, you explain again and you empathize with the patient. Now, here is where the concern is. You empathize, but you don't really have to show sympathy. You just have to show empathy with the patient. You have to show the patient, okay, this patient is, you are not alone. We are always here to help you. You can always stop by. You can always come. We'll do anything we can do. And then, of course, R is review or summary or recall. So this is brief about the gather approach, which is actually similar to that of the spikes approach. If you look at it, the perception is actually you asking her what she thinks about it, and then information or invitation is you as telling her, and then knowledge, of course, what she knows, and then you tell her more about it as well. Then the empathy and the summary is more or less kind of the same thing, but then the gather goes more in line with counseling a patient regarding a certain problem, and then the spikes, you use it more in breaking a bad news to the patient. So this is in brief how you go about counseling a patient. So if we are going to take some few examples. For example, I started with immunization. So for example, this mother, they refer this mother to you, that this is a mother that has refused. This is a woman who recently gave birth and was asked to take her child for BCG vaccination, but she has refused. So as the counselor of the as the counselor in the hospital, they referred this mother to you, that you should counsel her on the importance of immunizing her child. So of course, using the gather approach, you are going to greet this mother, uh, and then the examiner, since it's an examination setting, so you greet her. You greet your examiner. Good morning, sir. Good morning, ma. My name is My name is Dr. Aisha, and I'm a candidate for this exam. And for the purpose of this examination, I have been asked to counsel you regarding your refusal to give your child for immunization. Please, may I proceed? Please, may I carry on? Please, may I continue? Things like that. And then, of course, you ask her that, okay, then you ask her, what is your thought? What do you think? What do you know about immunization? Then she might tell you, I know immunization is just when they give the child injection, and then the child will just be crying, falling sick. Child will just be crying all day. Sometimes they get fever, they get sick, and they tell me that this immunization is supposed to protect the child, but instead of protecting the child, it is just making the child sick. Why should I give my child for all this trouble? Me, I don't have time for all these things. So she might tell you all that. You see that this is her perception, and absolutely, you know that this perception is not right. So, but then you don't interrupt her while she's talking. You listen to her, you listen to everything that she says, and then you tell her. This is where you say, okay, I have heard all you have said. So and so that you said is not right. But I will tell you everything that you need to know about immunization. So now that you will tell her what immunization is. So, what is immunization? Basically, immunization is like a means of boosting the defense system of the body such that the body can get strong to fight against infection. And then you do so by introducing certain substances that will help in boosting the immunity of the child. Then, of course, there are several types of immunizations. So you tell her, um, of course, you have the innate. There are certain types of immunity. You have innate immunity, and all those informations that you need to tell her. Then you tell her, okay, how are you going to achieve all this? You achieve all this by giving the child vaccinations. So, and these vaccinations, you have broadly two types. You have the active type, which is where you give substances which stimulate the body to produce its own defense against any microorganism that might come to harm the child. But the thing about active immunity is that it takes time to develop, but it lasts longer. Then you have the passive vaccines, which are preformed substances that you actually just give the child that will neutralize any ongoing infection. Its action is immediate, but it is less effective than the active immunity. Than the active type. So how you achieve all this is by giving the child vaccines. Then of course there's, for example, in Nigeria, you use the NPI schedule of vaccination. So you tell her all these things. What really are the advantages of giving the vaccines that you have been emphasizing that she should give her child for immunization? So, some of the advantages are it reduces risk of infections. It also reduces risk of hospitalization. It reduces the child's risk of developing all these childhood illnesses. It also provides herd immunity, such that her child serves as a protection to other children who are not immunized in the community. Then, of course, she is more concerned about the side effects. So you also tell her some side effects that the child may develop include fever. He can have some degree of fever. He might be allergic to the injections that you give. Then there might be some reaction. He might develop an alteration at the site of injection. But of course, you assure her that, Ma, but I would like to assure you that the advantages of giving vaccines far outweigh the disadvantages. So I strongly advise that you take your child for immunization. And then, of course, you tell her, okay, but Ma, there are certain contraindications. There are certain things that might stop us from giving your child this immunization. That is, if maybe, for example, you brought your child for immunization and the child reacted in the previous one, this can stop us from giving your child vaccines. Then also, if the child, like for example, she brings the child for vaccine and then the child is sick, you don't give immunization, you don't give vaccination, you delay it until the child gets well before you give. These are some of vaccines. And then of course she might tell you, maybe someone had an experience of, okay, there's this my neighbor that she took her child for all these vaccinations and stops, but he still gets sick easily. So I don't see any reason why I should give my child for it. Of course, there are certain reasons that might cause vaccines to fail. Some of these reasons include if the child is severely malnourished, these vaccines might not work. And then sometimes the vaccine might not be potent. Sometimes it might have expired. Sometimes it might be the person given the vaccine is not skilled. So it's given in the wrong way. So you tell her all this. So or maybe a vaccine that is supposed to be oral was given IM. So things like that might cause the vaccine to be not efficient. But of course, you assure her that, but ma, I would like to assure you that you have come to the right place. I would like to assure you that we will do everything in our we will do our possible best to see that we give you and your child the very best care that we can afford. So this is you telling her about everything, and then of course you can go ahead, and if you feel you have the stuffs and you have the time, of course I advise you do, you can tell her that I will if you have agreed to go ahead with the vaccination, I am going to give you a vaccine card. This vaccine card is going to serve as a guide for you to know when and what vaccine your child is supposed to take. And for example, in Nigeria, we use the Nigerian program the Nigerian program on immunization schedule, which is NPI schedule. And how the schedule is: at birth, we are going to give your child BCG vaccine, oral polio vaccine, and hepatitis B. Then at 6 weeks, you will bring back your child, where we will give him the pentavalent vaccine, which is a combination of 5 things, where we give diphtheria vaccine, tetanus, and pertussis, oral polio vaccine, PCV1, Rota1. And then at 10 weeks, of course, you still come back, we'll give the child Penta2 or PV2, PCV2, Rota2, and so on. You will see all this on the card, and each time you come, we will tick the vaccine that the child has received. And even if you missed any of these vaccines, do not think that is the end of the road. Always come back. There are catch-up plans. We will see what we can do to cover up all the vaccines that the child is supposed to get. So, Ma, please, have you understood everything that I said? If she has any questions or misconceptions, she will ask you again. If she doesn't, you can ask her to briefly tell you, okay, Ma, please, can you briefly tell me everything that I mentioned to you? Then she will tell you. Then, of course, in helping her, you still emphasize that. I would like to emphasize that the benefits really outweigh the risk of the outweighs the risk. So I will advise you to choose wisely, as you know your child cannot make decision now. You are the person supposed to make the decision for this child, and I suppose you make the right decision for your child in order for you and your child to have a great time of so such that your child will have a good your child would have good developmental milestones, free from hospital visits, things like that. Then you review, and then you tell her briefly, you summarize everything that you said, and if she has agreed, of course, if the child is a newborn, you advise her to take the child for the necessary vaccines and then continue as planned. So that is regarding immunization. I don't know if anyone has any question. I think we can address your concerns regarding immunization, and then we'll continue to the next case. So is there anyone concern, question, any clarification that you need regarding counseling a mother for immunization?
Yes, please, I have a question.
Okay.
Where there's this examples NPI schedule, like, are we supposed to tell her like everything from the vaccines
You
to
can
doses
like see,
to
like
where
I
it's
mentioned, you can
administered?
just tell her the few ones because you might not have time to tell her everything on the schedule. So you can just mention like at birth, then at 6 weeks, 10 weeks. Then of course you will have schedule according to the time until 6 months, 1 year. There are certain vaccines, but everything is on that card. If you say everything is on that card, you will see it. You have like covered, but still mention like the first few ones at birth, 6 weeks, maybe 10 weeks, or maybe just at birth and 6 weeks,
All right,
such
thank
that the examiner knows what you are doing.
you. Okay.
He might just tell you, okay, skip that part, you don't have to say it. That means he knows you know it.
Okay, thank you.
Okay, any other concern? So I suppose we can proceed to the next one then, if there is no question. So now, how will you counsel a patient with cervical cancer? Well, should we make it an interactive session? Does anyone want to attempt? Because you can even see it. You have some information here. Who wants to attempt? Come on, this is 9 days to exam. Who is volunteering?
Let me try.
Okay. It seems like Fatima is ready for this exam. I don't know what the rest are doing. Go ahead.
Okay. Good morning, sir. I am number so. Good morning, ma. I am Fatima, a candidate of this
No,
exam.
don't say you are number so. Do it like you are in the exam hall. Don't worry, I will be your patient.
All right. Good evening, sir. I am number 734. Good evening, ma. I am Fatima, a candidate of this exam. For the purpose of this exam, I was asked to counsel you on your condition. May I please proceed?
Yes, please.
I would like please to ask you some private questions. What's your name, ma? What's your age, ma?
My name is Miriam.
What's your age, ma?
I'm 35. 35.
What tribe are you, ma?
Hausa.
Where do you live?
I live in Kano.
All right. Are you married or single, ma?
I'm married.
What level of education have you attained so far, ma?
I have a degree.
All right, please, are you comfortable talking to me?
Yes.
Are you comfortable with the environment? Do you want anyone to be with you?
No, I don't need anyone.
Do you need a glass of water or a juice or anything?
No, thank you.
All right, please, I would like to assure you that anything we discuss is strictly going to be between me and you. It's going to be 100% confidential, okay?
Okay.
All right, ma, please, what do you know about cervical cancer, or have you heard anything about it, or do you have any information about cervical cancer?
Well, I read through it on Google, and what I can say is I am going to die. Doctor, please help me.
Don't worry, ma. You're not. It's not a death sentence. A lot of I have managed our facility. Have managed a lot of people with cervical cancer, and they're actually doing great now, like in life. So I'm going to enlighten you more about it and how you're supposed to go about it, inshallah. So,
Okay,
cervical cancer is a sexually transmitted infection, and the risk factors are sexual life, smoking, alcohol, genetic, and maybe immunosuppression. Then it is caused by, there's this organism that it is caused human papillomavirus.
Sorry, can I interrupt you a little bit? You said sexual life. Actually, by sexual life, I know you are referring to HPV, right? And
Yeah.
then in these cases, you are more concerned about having multiple sexual partners, right?
Yeah.
So it's better you mention what actually you are pointing towards. This is just like a guide.
Okay. I don't really like.
So you'll be like, okay, there is no specific cause that I can pinpoint you and say that this is what caused it. But certain things have been identified to increase your risk of developing this type of cancer. For example, if you have had multiple sexual partners in the past, if you smoke, if you drink alcohol, some genetic, which is something that you can't control. This is something that your body is made up of. And then immunosuppression, if you are on certain medications, or some, if you have some infection like HIV or something like that. Like, just mention an example of each. Can you hear me now?
Yes, we can hear you.
Am I audible now?
Yes, you are.
Okay, let's continue because I can see that I'm audible. Okay. Okay, since we've lost Fatima, or she doesn't want to continue, and nobody wants to continue. So of course you start telling her, you tell her the risk factors and then the clinical features that she's likely experiencing them. So you tell her some clinical features of this condition include you might have an you might be having vaginal discharge that has an unpleasant odor. You might be bleeding after sexual intercourse. You might be having some lower abdominal pain. You might be feeling weak. You might be getting too tired easily in later stages of this condition. Then some certain complications that you are likely to develop include vesicovaginal fistula, which normally occurs in end-stage untreated cases, which is an abnormal connection between your vagina and the bladder, which will cause you to be having continuous leakage of urine. You can also have a rectovesical fistula, which is an abnormal communication between where feces is stored, that is the rectum and the vagina, which will be causing you to have fecal incontinence. Then you can also get anemic in the long run. The cancer can spread to other parts of your body, such as the lung, the brain, the bone, or your breast. But these are all things that can be prevented if treated appropriately. Sorry, please, I just lost connection. Let me reconnect so that you can be seeing the slides. So of course you tell her all those informations that she needs to know about it. Then you tell her about all the investigations that you are supposed to do. So you know that you are going to run some blood investigations. Then you will take a biopsy of the lesion to see, then CT scan, MRI. But at this stage, she has already been diagnosed and you are already counseling her. So already you have carried out all these investigations. And then you give her the treatment options. So you tell her the treatment comprises of, you can go for surgery, you can go for chemotherapy, you can go for radiotherapy, and the choice of the treatment plan depends on the stage of this cancer.
Recording in progress.
And I would like to assure you that this is one of the cancers that can be cured completely if detected early. Am I audible? So you assure her that this is one of the malignancies, that one of the cancers that you can actually cure if picked at an early stage. It has a good prognosis. then you help her. Of course, this is a patient that came to you telling her that she's going to die because she has cancer. Because people think once you have cancer, it's like a death sentence. You are just going to die. So you help her choose the appropriate treatment plan depending on the level, on the stage at which she presented. If it is at a stage that you can completely take out the tumor by surgery, then if it is a stage that you have to debulk and then you have to debulk with chemotherapy, then go for surgery, then maybe radiotherapy. That's a combination of all. In some cases, just surgery will be sufficient. In some cases, you might have to combine surgery with chemotherapy. In some cases, you have to do all three: surgery, chemotherapy, and radiotherapy. And in some cases, it's even just going to be just palliation, because all these treatment plans, they can only buy her some time. Like, you are just trying to give some palliation so that she could live with comfort. So of course you empathize with her. You tell her that this is not the end. This is not the end. It's not a death sentence. She's not the only one. You have seen several cases like this, and then you have successfully treated. If maybe she presented with at an early stage, you can tell her that we have seen so many patients like this who are now cancer free. So please just adhere to the treatment plan, and assure you that by you are going to get better. Then of course you review with her whether she understood everything. Then you can briefly recall everything that you told her, and then you give her, sometimes I'm going to give you go over the treatment plan, then you give her time for follow-up when she'll come back, when she'll start management. And then of course you thank the patient, then you turn and thank your examiner as well. So any question regarding counseling for cervical cancer? And then of course this is something very preventable. So in the process of telling her as well, you can tell her that this is because most of these cancer patients that you are seeing, they become advocates of these cancers in the community. So you tell her that this is something preventable by doing regular pap smears, such that she will become an advocate in her neighborhood. Each woman she sees, she'll tell her, go and do pap smear. This is something before you go and get cervical cancer, be doing this pap smear. It's very important, because most women, after they give birth and you tell them to come back for pap smear, they don't come back. But when you have patients like this, if you explain everything correctly to them and you tell them that this is something that can be preventable, they'll go a long way in educating members of their society about the dangers and how they can easily prevent this condition. So this is something that you can take the opportunity to also tell the patient. So this is about cervical cancer. Any questions? Any need for clarification? And of course, someone is going to take the next one. Okay. Since there is no question, let's move on to the next one. So who is taking this protein energy malnutrition?
I will try, ma'am.
Okay, go ahead.
Okay. Good morning, ma. I'm number 147. Good morning, madam. My name is Muhammad Yusuf. I'm a candidate of this exam. And for the purpose of this exam, I have been asked to counsel you on your child's condition. I assure you whatever we discuss will be between me and you. and I will not disclose it to anybody without your permission. May I please proceed?
Okay, so here, since you are like the patient is a child, you can as well go ahead and ask, what is your relationship with the patient? It might be the mother, but don't be surprised, it might be an aunt, or the co-wife, or the grandmother, the sister. It can be anyone. It might even be a neighbor.
Okay.
So you should ask the relationship of the guardian to the child.
Okay.
Carry on.
Okay. Ma, may I confirm your relation with the child? Okay. Can I confirm your name, your age, marital status? May I also confirm your relationship with the child and the name of the child and how old the child is and the level of education of the child? So Ma, what do you know about protein energy malnutrition? Okay, I will tell you. Protein energy malnutrition, referred to as a range of disease that arise from lack of protein in various proportion. We classify protein energy malnutrition into kwashiorkor, marasmus, and we also, and for the knowledge, kwashiorkor patients have growth retardation. They also have edema, muscle wasting, mental changes like dullness, moon face, and hair changes. And it's most commonly in children between the age of 1 to 3 years. Whereas marasmus patients present with wasting appearance, old man face, saggy pant appearance, and it's common in children between the age of six months to 1 year. Protein energy malnutrition is one of the major killers of children in the sub-Sahara, and the common risk factors or the predisposing factors to protein energy malnutrition are measles, malaria, TB, and immunodeficiency like HIV. And it can also be associated with inadequate breastfeeding, poor weaning diet, poverty, and ignorance or illiteracy. Aside from other complications of protein energy malnutrition include diarrhea, hypoglycemia, and also bleeding tendencies. Investigation for protein energy malnutrition includes measurement of mid upper arm circumference, measuring of height, weight, blood culture, urinalysis, and many more. In treatment of protein energy malnutrition, we follow different phases like the resuscitation phase, consolidation, and rehabilitation phase. In the resuscitation phase, it's usually in the first 7 days of the treatment where we correct the dangers, the immediate dangers of the child, such as hypoglycemia by administering dextrose water, hypothermia by ensuring that the patient is warm, and by treating infection with broad-spectrum antibiotics. And in the consolidation phase, we investigate and determine the causes and treatment of complications accordingly. In the rehabilitation phase is where we counsel the mother and we initiate the feeding and give support to the family. Do you have question Do you have question for me?
Question for me?
Do you
Do you
understand all
understand all I have?
Can you
Can
repeat
you
what I put in two sentences? Okay. After we commence the treatment, we would like to see you come back again so that we can check how the child is doing. And this will continue for at least 6 months. Don't worry, Ma. I assure you that we have handled these conditions before, and we have the best team in our facility that can handle the child. Thank you, Ma, for your time, and thank you, sir.
Okay, that was a very good attempt, but do you know what you missed?
No.
You can tell her all this information, and most of the time you hardly see educated parents bringing their child with protein energy malnutrition. It's mostly people coming from the rural areas. So you can give her all this information. If you do not tell her the type of food that she's supposed to be giving the child, how do you expect all your management to work out? All your plan, how will it go? So you have to tell her. Sometimes you will see that they actually have these foodstuffs. Of course, they have their greens, they have their maize, millet, beans, they have tofu or awara. They have all these things, but they don't know how to combine them such that it will be nutritious for the child. So you have to tell her all these combinations. Okay, it's not just okay, they say the child does not accept anything, just pap, or it's just cocoa that he accepts, or kunu. Then you tell her that there are several ways in which you can fortify all these traditional foods that we have. For example, this pap, it doesn't have to be just plain pap. If he's accepting pap, fine and good. This pap, you can add so many nutritious things inside pap. You can combine different greens. You can add millet. You can add what there are these several combinations that they used to do. You can add wheat. You can add if they even have the means, they can be adding milk inside the pap such that they fortify it and it becomes nutritious for the child. And then sometimes you'll tell them, be giving the child egg. She will tell you, doctor, he used to eat egg. He eats egg every day, one in the morning, one in the afternoon, one in the night. You will be surprised if you tell her, okay, what are you giving him? Maybe she's eating the egg white and giving him the egg yolk. That is one egg for her. She eats the egg white, she gives him the egg yolk. And then, of course, everywhere now, there's awara. This awara goes a long way in preventing all this type of things. If they cannot afford fish, they cannot afford meat, you tell her all this type of things. Groundnut, they can put all these things inside the pap mixture, and it goes a long way. These are things that they can easily afford, they have them available. So you have to explain all these type of things to her, that it doesn't have to be rich man's food that she has to go and be feeding the child. Everything that she has surrounding her is just to fortify it and make it rich for the child. So don't forget to include this when you are counseling this type of patients. But other than that, everything was okay.
Okay, thank you, ma'am.
So, any need for clarification? Any question? Or can we proceed? So far, 2 people have attempted. Who is taking the next case? I want a volunteer before you even see the case. Who is confident? Who is ready for this exam? It's just 1 week remaining. Who is volunteering to take the next one? I'll soon start calling names. Seriously, there's nobody with hepatosplenomegaly in this group.
It's sorry, I just came in late, so I don't know what you guys are picking. I would have stepped up. So
Go ahead, pick. It's counseling. You are just going to counsel a patient. Just pick.
counsel a patient about anything.
No, you have volunteered, right? You will see
Yeah.
it in the next slide.
Okay, like I have to explain to the patient about anything, or just about what you mentioned here. Like what I'm seeing on my screen is PEM.
No, this patient has been counseled. Muhammad just counseled this mother. So I'm going, when I move to the next slide, you'll counsel
Okay.
on what
Okay.
is.
Okay. All right then.
Okay, go ahead. You're even lucky.
Family planning.
Yes.
Okay.
Counsel a couple coming to you.
Okay. I'll begin by Okay, I'll begin by
No,
greeting the
don't begin.
patient.
You are in the exam hall already.
Okay, I'm in the
Just
exam hall.
counsel me.
All right then.
Counsel
Okay.
me.
Okay. Okay. What's okay? Good morning. My name is Shuaib, and may I proceed? I want to ask you some questions.
Okay.
I want to talk to you about what we call I want to talk to you about family planning, and what I think about family planning is are you do you have you any idea do you have any idea about what a family planning is?
Okay, Dr. Shuaib, let's do it this way.
Okay. Come back
Of course,
here.
you've greeted.
Yeah, sure.
You've greeted, of course, you've greeted the examiner, but I don't know who you greeted among us. Is it the examiner or the patient? Because
No,
you greeted one person.
I'm greeting the patient.
Okay, the examiner, you don't want to greet him? You don't want his marks?
No, I'll greet the examiner as well. All right. Okay.
So,
should I begin again?
Once you come, good morning, sir.
Okay.
Good morning, ma.
Okay.
That is it. You have greeted your examiner, you have greeted your patient. Then you introduce yourself. My name is Shuaib.
Okay.
Number so you tell them your exam number.
Okay.
I'm a candidate for this exam.
Okay.
And I have been asked to counsel you regarding what brought you to the hospital.
Okay.
Please, may I proceed?
Okay.
Say you have introduced yourself and you have sought permission.
Okay.
Then I will tell you, yes, doctor, you can continue. Okay, please, I would
Okay.
like to ask you some questions. Please, what is your name? Will you just go ahead and be talking to someone that you don't even know the person's name?
Yeah.
If you are in
Right.
ticket, so you ask the patient, please, ma, what is your name? And I'll tell you, my name is Halima. Okay. Please, are you married? How old are you? Please, what is your level of education, ma? Please, where do you live? You ask her all this: name, age, tribe, level of education, if she's married, how many children she has.
Okay.
Since this is about contraception, so you ask her all those things, and she will tell you. Then you now go into the actual matter of the counseling. Okay, ma'am, I have been told that you are here because you would like to have a family planning. You want to have family planning, or you want to use a contraceptive method. Then she will tell you yes. Then you go ahead. Okay, ma, please can you tell me what you know about family planning? Then she'll tell you, family planning. This is something that I had my neighbor. She told me that if I don't want to give birth to children every year, I should come to the hospital and just tell them I want family planning. This is something she will tell you. Then, of course, depending on the level of education, you will have to lower down your grammar and your English. if she just attended primary, of course you won't talk to her like you are talking to a secondary school graduate. And then of course you won't talk to her like you will talk to a university graduate.
Okay.
Something like that.
Okay, I understand.
So
Thank you very much.
yes, so go ahead.
I should start from the beginning.
No, we have corrected the part that you missed.
Okay. So
Continue. You stop.
I think you've already told everything. Okay.
No,
No, you
you are now you are supposed to tell her. Tell her
Okay.
what family planning is. Tell her what contraception is.
Okay. I would like to tell I would like to speak to you about what a family planning is, because I've understood from your point of view. You have told me how you understood family planning. Basically, it's not to stop you from giving birth or anything like that. Family planning is a way of from the name, is a way of planning your family, and a way of knowing how much responsibility you have for your family, and how much do you have to cater, and how much can you afford for your family in that regard. And you it's basically overall way to assess how you live your life, how you live according to your according to your according to your according to your means, and according to how you can cater for your family, according to how you can take responsibilities. So maybe
Dr.
you might have
Dr. Shoaib, we are actually talking about contraception. Family
contraception.
planning as in contraception.
Okay. That's what I said. I jumped into the thing actually. You made me do this, so I don't know. I should have just waited for a while. I should have waited for a while. Somebody should have talked first. Right?
No,
Yeah?
it's okay. It's
Okay.
okay. You have the confidence. This is you never know. It might be it might be family planning coming in the exam, and it might be this discussion that you will remember, tell the examiner. So it's
Okay.
perfectly fine.
Okay. So basically now I would want somebody to just speak from the beginning so that I would get the picture actually.
Okay.
Yeah.
Okay, let me carry on from where you
Yeah,
stopped. So now
Okay.
that she told you that, okay, my neighbor told me that if I don't want to be given birth every year, I can come to the hospital. There's an injection that they will give me, and I will tell them when I want to get pregnant, and then I will just stop the injection. So she tells you something like that. Of course, she's on the right track, but it seems like she doesn't have enough knowledge on what actually it is and how it is done. So you now tell her, okay, ma, I would like to tell you what contraception actually is. Contraception basically means there are methods in which you use to prevent pregnancy from occurring. If So this is just you defining contraception in a layman language. It's a way of preventing pregnancy.
Okay.
And then, of course, the best way I can tell you, 100% assurance way of avoiding pregnancy is abstinence. If you stay away from sexual intercourse, there is no way you will get pregnant. You will get pregnant. That is 100% protection against pregnancy. But then, since you are married, and even if she's not married, since that is not an option, abstinence is not an option, then there are several methods that can there are several methods of contraception. We have the natural method, and then of course we have the artificial method. So in the natural method, we have several examples like abstinence that I mentioned earlier. This is avoiding sexual intercourse completely, and which can be very difficult, especially since you are married. That is, if you have asked her in the introductory part and she tells you she's married, don't go and tell someone that is not married. a statement like this. You should
Okay.
always carry your information along with you, whatever you ask the patient. Then another natural method is coitus interruptus,
Mm.
with or the withdrawal method,
Mm.
in which the husband withdraws. This is
Mm.
actually also not so uh
Come on.
what am I trying to say? This is not
So
uh
effective.
yeah, too effective, because
Mm.
it has a high chance of failure,
Mm.
and then it needs high discipline actually to have
Okay.
this withdrawal method work. Then of
Okay.
course she can track her menstrual cycle, know
Okay.
when she's ovulating, and
Mm.
avoid sexual intercourse at the time of her ovulation. So
Okay.
her avoiding sexual intercourse at her in her fertility period during
Okay.
her cycle. Then of course we have lactational amenorrhea. This is
Mm.
when completely she does not have any menstrual cycle while she's breastfeeding a child. But
Mm.
this is different for different women. Some women menstruate while they are lactating, some
Mm.
do not. This is
Okay.
also not 100% effective. It
Okay.
doesn't work for everyone.
Okay.
So these are all
Okay.
natural methods, but as
Okay.
you can see, they have high failure rates. Then we have the artificial methods. Then in the
Okay.
artificial, there is the temporary ones and the permanent ones.
Okay.
So for example, like permanent artificial, the ones that you cannot reverse them, it's
Okay.
very difficult to reverse. Once she do it, that is the end of the road. She cannot come back. You cannot come back and tell me that you have changed your mind. You want to
Mm.
get pregnant now.
Yeah.
You
Okay.
have to clearly tell her. And some
Okay.
of this example is, for example, in the man, he
Mm.
can go for vasectomy,
Wow.
where you like get the spermatic cord of the man in a minor surgery and you cut it, and he will not be able to father children again. He won't be able to get a woman pregnant. The chance is very, very low.
Mm.
So, and then for the woman, she can go for bilateral tubal ligation.
Mm.
Mind you, I said bilateral.
Mm.
Both the tubes have to be
Mm.
ligated for it to work. If you go and ligate one, you can get pregnant with the other tube that hasn't been ligated. So you have to ligate both the two. And
Okay.
then, of course, you can do this after she has given birth. It's a
Mm.
minor surgery and it's permanent.
Okay.
But then that doesn't stop her from getting pregnant. Actually, it can increase her chances of having ectopic pregnancy.
Okay.
Since you have ligated the tube, she can fertilize an ovum, and then the ovum will just implant somewhere else. Since you have blocked the road for the ovum to come to the uterus and implant.
Okay.
So that is one complication that can occur. So that is about permanent artificial methods. Then you also tell her that then there are other temporary artificial techniques that you can go for. There are several methods. For example, there is the barrier method, where you can use either male or female condoms. And then another advantage for this barrier method is it protects against sexually transmitted infections, in addition to preventing pregnancy. And it is very cheap and readily available. But of course, the condom can slip, or it can tear, or either her or the husband can have an allergic reaction to the material used to make the condom. Then that is one alternative. That is barrier method. Then another type is oral contraceptive pills. This is for someone with high discipline. If she can stand to take a tablet every day, sometimes she might forget. And then it has discipline too. You have to have a fixed timing to be taking it. So she might take it in the morning today and tomorrow decide to take it in the evening because she forgot to take it in the morning. So that is also another disadvantage of oral contraceptive pills. So and then of course there are some patients that you cannot give them these oral contraceptive pills. For example, if she has a family history of deep vein thrombosis, or if she's breastfeeding, or if she's more than 35 years. Of course, if she's pregnant, you won't give her. Then some complications that she might develop include increasing her risk of having deep vein thrombosis because it causes stasis. Then she can develop hypertension. And then if it can also increase her risk of having myocardial infarction because of the stasis that it causes. Then another example is the progesterone pills. All these contraceptives that you tell her. Then of course you have the injectables where you can give her progesterone either once every 3 months depending on the schedule. Then there are the implants where you have the Implanon, Norplant, Jadel, all this that you just place in the arm. You just make a little cut and place it under the arm. Then you tell her that each time you tell her how long they last. They can last for 5 years, but that does not mean she has to wait 5 years before she can remove it. If, for example, she gets it today and she decides after 1 year that, okay, I want to get pregnant now, I feel I am ready, she can always come back and remove it. And then, of course, you tell her the likely complications that she might experience include menstrual irregularities, or in some instances, she might not even be having period at all. Then you have the IUCD devices, which you just insert an IUCD device into the uterine cavity. You tell her that she will just be seeing the string, but at any time she does not see the string, she should come to the hospital so that you check. Sometimes she might have lost it, or it might have gone high up into the uterus. Then this is about the temporary artificial contraceptives. Then other methods, then you have the emergency contraception. This is someone that is not on contraception. Maybe the person likely had an unprotected sexual intercourse and does not want to get pregnant. So these are ones that will come to you either immediately after having the sexual intercourse, or maybe within 24 hours that this is what happened and I would not like to get pregnant. And this is something that you can also use for rape victims that come to the hospital. After taking all your investigations, you can advocate this to the guardians of the raped victim, that this is something that we can do to avoid unwanted pregnancy. So you tell her all this about contraception, and then you assure her that, okay, we are going to assess you, carry out the necessary investigations, and see which one will be more convenient for you. If you would be okay to be taking pill every day, if you won't be forgetting, if you want to go for the implants in the arm, if you want to go for IUCD, whichever one you decide to go. So you give her the chance to choose the appropriate treatment after explaining everything to her. And then, of course, you tell her the advantages of having you encourage her on her decision to actually go for contraception. You tell her that it will give her time to take care of her child more, bond more with her child, and then she won't be having to be breastfeeding one while being pregnant at the time. It will also give her body time to heal well after pregnancy, and all these unnecessary financial struggles that she can avoid by planning her family well. So you ask her if she understood. Please, ma, have you understood everything that I said? Yes. You can ask her, please, can you briefly tell me everything that I told you? Then she'll tell you so. If there's any place that she made mistake, you correct her. Then you give her an appointment for the next visit after she goes home. Sometimes she might have come with the husband, sometimes she might have come alone. So you, after explaining everything, if she came alone, you tell her, okay, now that I have explained everything to you, I will give you some time to go back home and discuss everything that we discussed with your husband and decide which one you think will be more convenient for you and your partner. I will give you appointment to come back when you have decided on what method you want to go ahead with. Then you thank the patient and you thank the examiner as well. So, any question, any contribution? So, Shoaib, have you gotten the gist of what we were discussing?
Yeah, I got it.
So this is how you go around it. So any question, any need for clarification? And who wants to take the next one? Let's try and take, even if it is 2 more, and then we can call it a day. I know you are all tired. Who is taking the next one?
I want to take it, but I might be breaking because my network is bad.
No problem. Carry on.
I want to hope you hear me. Okay, good morning, sir. Good morning, ma. My name is Olad.
Okay, she warned us even before we started, and the network failed to disappoint her. Someone with good connection, please.
I try.
Yes, please. So, sorry, your network is bad, so we will go with another person. It's Amra wanted to try, right?
Yes, can I try?
Okay, go ahead.
Okay, so good evening. My name is Aisha Salihu. For the purpose of this exam, I've been asked to counsel you on HIV. So please, can I know your name, ma? Can I know your age, your tribe, your religion, your occupation, and your marital status? Okay, so ma, what brought you to the hospital? Do you have any idea? First of all, I would really like to empathize with you, and I see that you're really a very strong woman. So I would like to tell you what is HIV. HIV is a single-stranded RNA containing retrovirus infection. So this virus is a bloodborne virus and can only be transferred from one human to another woman. So the good news is that I want you to know that even though one might be diagnosed with HIV, a productive and healthy life is still positive. So it doesn't mean that just because you've been diagnosed with HIV is the end of the world. No, ma. We have some medications, and we have many people that have been diagnosed with HIV and they are still living their life. They have a long life and they are healthy, which means by keeping a very healthy lifestyle, having your medications and everything, you can still live with HIV. The risk factors for HIV, there are risk factors, doesn't necessarily mean that's what caused your own HIV, but there are other risk factors such as sexual workers, long distance drivers, maybe injury due to a sharp object used by an infected person, IV drug use, or other causes that might be a risk factor for HIV. There are two main types. There's a type 1 and there's a type 2. The type 2 is more commonly seen, majorly in the West African regions. It's less aggressive and it doesn't immediately progress to AIDS. There are symptoms that come with HIV, and some patients appear asymptomatic. Some patients experience weight losses, and also the patient can present with oral candidiasis or unexplained chronic diarrhea for more than a month. And you might also experience unexplained persistent fever also. There are complications that happen with HIV, such as AIDS itself. It might lead to AIDS, acquired immune deficiency syndrome. It can lead to HIV nephropathy, wasting syndrome, encephalopathy, and other diseases that are the complications of HIV. But I'm not saying all this to discourage you or to scare you or to make you feel like there's no cure. No, there are certain investigations that we might carry out, such as antibody tests, antigen tests, and other non-specific tests. We might also do we will do the Western blot test, and your full blood count will be checked, and other investigation, even hepatitis B screening, Mantox test, chest x-ray, and other tests that will be carried out. So, and in order to prevent HIV, there are some measures that are taken, such as avoidance of multiple sexual partners, changing of your lifestyle and modification, use of barrier methods of contraceptives, such as condom, and avoid sharp needles and objects, and ensure that you get a blood screening before transfusion or any other thing. So for the management, but there's a treatment that is used for HIV, which is known as the highly active antiretroviral therapy. It's commonly used. And also there are other medications such as lamivudine, zidovudine, ritonavir, and other medications that will be used. And from all this that I'm saying, Ma, please, are you understanding what I'm saying? Can
So,
you
doctor,
tell me?
please tell my family.
You said?
Are you going to tell my family that I am HIV positive?
No, everything that is being discussed here is strictly confidential. And I want to assure you that whatever we have discussed here will only be said to other people with your consent.
So you forgot to give her
I
that
forgot,
assurance of
yes.
confidentiality. And it's very important here.
Okay.
You did very well, especially with the fact that you didn't bother to know how or where she contracted this HIV. It is none of your business how she got it. You
Okay.
are just there to counsel her. So you did very well. You did your job as the counselor. Because this is something that people might like to be nosy about. Where were you going to? How did you get it? That is
Okay.
not your business.
So I
So
think that
yes,
thank
that
you.
was another good attempt. So who is going to take the next one? And I think we can call it a day after the
Sorry,
next one.
sorry, please. I have a question about this HIV
Okay,
counseling.
okay.
Like after you finish telling her everything, like are you supposed to like tell her like if like maybe she is married, are you supposed to ask her if she's supposed to bring her husband in for testing so
Yes,
that yeah, or if
yes,
she like her children or something like that?
yes. If she's married, of course you ask her whether she knows the status of her husband. Sometimes
Husband.
she might be aware that the husband is positive.
Mm-hmm.
Sometimes she might not know. And don't be surprised, the husband was positive even before he married her. And she's just finding out. So you
Okay.
see things like this happening. So of course you will ask her if she knows the status of her husband, and if she and like I asked her if she's going to tell my family. Sometimes these patients can be very, very adamant. They don't want to tell anyone in the family, especially when it is the husband. He doesn't want to tell the wife. Because there was this time that we had a patient that refused to tell the wife he's HIV positive. Each time we go there for round, have you told her? No, I'm waiting for the right time. He was just trying to dodge that the consultant of the team had to actually tell him that, look, if we come tomorrow and you don't tell her, I am going to tell her myself. Because it is actually her right to know. Because she also needs to get tested and know her status. If she's to be started on medication, if you are going to give her prophylaxis, exposure prophylaxis, things like that. So for people that have been in contact, especially between husband and wife, and then mother and her child that she has been breastfeeding, things like this, you have to address it.
Yeah,
So
I
of
mean, and
course,
patient is a female patient. Like, are we supposed to tell her about mother to child transmission or like just there's no need, or it depends on
yes, you
them?
can ask her, have you been pregnant recently?
Okay.
And then you might be surprised, she might be coming down with AIDS. So you can ask her last child, how old her last child is. Then maybe you might be able to calculate, okay, it's likely that she was pregnant and was positive even at that time.
Yeah.
And then sometimes these patients have none of their status long back, but they just decided to come to the hospital now. I have seen many of these patients. They have been positive for like 10 years. They hid it from the children. The father and the mother are aware, but they hid it from the children. Sometimes they are even treating the children without the children knowing. They are giving them their own antiretrovirals, but the children are not aware. They will just be telling them it is multivitamins, it is multivitamins. So things like that, you can address them.
Okay, thank you.
Okay. So who is taking the next one? Who is taking the next case? Anyone? Or should I call name? There are two iPhones. One of the iPhone. One of the iPhones should unmute and counsel the next patient. Okay. I think they are not interested. There's one MGI. Go ahead. Is it that everyone is sleeping? Or you just joined the class and disappeared? Okay, let me show you the next slide. Maybe you will be interested.
I'll try.
Okay, go ahead.
Okay. Good morning, ma. Good morning, ma. My name is Samia and I'm candidate of this exam. Registration number is 717. And for the purpose of this exam, I've been asked to counsel you regarding your visit to the hospital today. Please, can I proceed? Thank you very much, ma. Please, can I confirm your name, age, tribe, religion, occupation? Are you single, married, or divorced? Where do you live, and your highest level of education? Ma, how are you and how is your family? When was your last menstrual period? Ma, have you had any pregnancies in the past? How many have passed 28 weeks and you've delivered? When was your last childbirth? Okay, ma, I just want to assure that whatever we discuss here will strictly stay between us unless you decide to disclose to someone else. Are you comfortable, ma? Is English your preferred language, or would you like me to get a translator? Okay, so ma, please tell me, what do you know about genotype? Do you know what sickle cell disease is? Do you know your genotype? Do you know that of your partner? And okay. Okay, thank you very much, ma. So, ma, thank you for coming to me to discuss this issue. First and foremost, I'd like to congratulate you on your decision to get married. Marriage is a beautiful thing in a society. So, but before you proceed to get married, there are some important things you need to note before making this decision. That there are some important things you need to know. And thank you for coming to me today to discuss this issue. I'll try my best to explain everything you need to know about sickle cell disease and your genotypes and their implications if you decide to get married. Okay, so basically, a genotype is a genetic material that is passed on from parents to their children. And we have three main types of genotype. We have the AA, which is the normal genotype, and it's and usually it's characterized by normal RBCs that are donut shaped. And then we have the AS genotype, and in this case, the patient is a carrier for the sickle cell disease. However, he doesn't have the disease. And then we have the SS genotype. In this case, the patients have sickle cell disease. Both the hemoglobins are SS. So yeah, and then we have so basically sickle cell disease is an autosomal recessive disorder. It's an autosomal recessive disorder caused by an caused by a mutation in beta globin chain in the amino acids in our body. So basically, what happens is normally our amino acids have glutamic acid in a particular in the 6 codon. However, in sickle cell disease, it is replaced by valine, and that's what causes the disorder. Okay, so usually patients with sickle cell disease will present with symptoms like fever, recurring fever, severe pain, hand and foot swelling, severe pain, frontal bossing, so enlargement of their head, abnormalities basically in their facial structures as well. So usually if untreated, sickle cell disease can lead to complications like anemia, because your RBCs are affected in this case. So they can be present with anemia, renal failure, dehydration. Usually the triggers for this condition include high altitude, exposure to extreme cold, stress, dehydration, infections like malaria. Okay. So I know you've decided to get married. However, before you proceed to get married, I would like to state some important things for you to note. Okay. So you can decide to get married and not have children. However, in our society, this might not be the most acceptable, because a marriage is considered unsuccessful if the couples are not able to give birth. Also, you can decide to get married and adopt, which is also not a very common thing in our society, as most mothers like to give birth to their children. You can also decide to get married and try your luck, hoping that you don't give birth to a child that has sickle cell disease. You can also decide to get married and also undergo some investigations whenever you get married. So you can do an amniocentesis at 15 to 20 weeks to check the genotype of your baby. Or you can do chorionic venous sampling at 11 to 14 weeks. There's also something we call the pre-implantation genetic engineering. However, this is not a very common thing in our society, and it's relatively very expensive. It is usually done to check the genotype of your baby, and if the baby is a sickle cell, you can then abort the pregnancy. Okay, but like I mentioned, this is quite expensive and it's not very common in our society. Okay, there's also the sickling and the solubility test you can do during while you're pregnant, or the hemoglobin electrophoresis. Usually to treat the sickle cell disease, we give medications like hydroxyurea, blood transfusion in severe cases. We can also give you Proguanil, which is a prophylaxis that can be taken while you're pregnant. The malaria prophylaxis you take when you're Proguanil. Okay, so it's malaria prophylaxis basically. Okay, and then last option is that you can decide to break up and find suitable partners for both of you that are not sickle cell. Okay, so I know I've said a lot, but I just want to assure you that whatever decision you and your partner decide to make, will be here to support you and make sure you don't have any obstacles along the way. So do you have any questions you'd like to ask me in 1 or 2 sentences? Can you repeat 1 or 2 things to understand from what I said? Okay, thank you very much, Ma, for coming to me once again. Have a nice day.
Okay, that was a smooth counseling. And, anyone with question, anyone that needs clarification? I think she touched
I missed
all the
one thing. I didn't talk about the probability. I think that's important.
Yes, very important.
Yeah.
You didn't talk about what? I didn't get that.
So the probability, basically, if they decide to get married and they're both, let's say AS, like in this case, there's a 50% chance that their child would be AS, and a 25% chance that their child can be in AA or SS, basically. So the pedigree charts, basically.
So
That
who
was
has
a good
question?
one.
Thank you.
Okay, since we have like 10 more minutes, I think we should take one more and then we can call it a day. So who is going to take the last one? Who is taking the last one? I think you have all slept. Jamil, do you want to take the next one? He's also sleeping. Hafsa. Hafsa, take the last one. Where is everyone? Why are you saying nothing?
Okay, maybe can I try again?
Yes, please go ahead.
Okay. Good evening, ma. Good evening, sir. My name is Aisha Sadihu. For the purpose of this exam, I've been asked to counsel you on smoking cessation. May I proceed? So can you tell me your name, your age, your tribe, your religion, your occupation, your marital status, and your preferred language of speaking, please? I want to ensure that whatever we speak here, it's between me and you, it's strictly confidential. I'm glad to have you here because I'm well aware that people stay away from seeking professional help for quitting smoking. Some are even shy to come out because they are afraid of stigma and other things. So, sir, please, I would like to ask you, when did you start smoking? And what do you smoke? Do you smoke tobacco, cannabis, opium, herium, or any other thing? And please, why did you start smoking? Is it due to peer pressure or due to stress of life, circumstances that were uncalled for? Have you ever tried to quit before? Okay, so did you ever fall ill when you tried quitting, or you never even thought about quitting smoking? So, okay, I would like to ask you a sensitive question, please. Do you also smoke alcohol? Do you also drink alcohol along with smoking, or you just smoke without alcohol intake? So, basically, I want to enlighten you on smoking. Smoking is a practice in which a substance is burned, and the resulting smoke is breathed in to be tasted and absorbed into the bloodstream. Commonly, smoke substances are things such as cigarettes, which contains nicotine, and also there are tobacco, heroin, opium, and other things that people smoke. There are many reasons why people smoke, such as the peer pressure I asked. Some look at others as role models. Maybe they smoke and then they also intend to smoke like them, or maybe due to challenges of life and stress and other things. People who smoke may have chronic cough with rusty sputum, and they might also experience weight loss, dark lips, and other features. Basically, this smoking, it exposes you to multiple diseases such as diabetes mellitus, chronic obstructive pulmonary diseases, bladder cancer, infections such as pneumonia, oral ulcer, and other things that might result from smoking. So I want to ask you, are you ready to begin the therapy for quitting smoking? Our treatment will be one of the best effective with your cooperation, of course, if you're willing to quit and once and for all and forever. So first of all, if it's due to peer pressure, you need to avoid those friends that influenced you, and also avoid any events that might encourage you to smoke. Also, there are certain medications that can be used in your treatment, such as bupropion and also varenicline, and these are medications that can be given. And also, there are other things such as the nicotine gum and also electronic cigarette that can be given. And to ensure that you quit this smoking, you need your support groups, such as maybe your family or someone you trust in, someone that will guide you and make sure that he stays for you as you're having this section of smoking cessation. There are other things that might occur when in the process, such as withdrawal symptoms, and you may also experience weight gain, increased appetite, and sometimes you might be shaking, and there are other things that will happen, but all these things are things that will not discourage you to stop it, because it's better to stop it than to harm yourself in the nearest future. So once you notice this, you might have a strong urge to go back to smoking. So we give you anxiolytics that will help you to calm down your body. And please, we need to ensure that you have someone that will be there to guide you. So, sir, in 1 or 2 sentences in the things that I've said, can you explain in 1 to 2 words what I've said? Have you understood what I've said? So, sir, if you have agreed with everything that I've just said, I'll need you to sign a consent form in the presence of my senior colleague so that I can go ahead and book you. It is in our greatest hope of this hospital that in 3 months' time, we will make tremendous progress with you. So if you give us your permission, then we might proceed. Thank you very much, sir. Have a good day.
Okay, that was another good attempt.
Yes, I think Aisha is awake now. Before she was sleeping. Well done, Aisha.
Thank you.
So I think we'll stop here. Well done, everyone.
Thank you very much, Dr. Mariam, for this wonderful presentation, and everybody that participated have really tried. So it is expected that we go over and over the various topics of counseling. This slide is just a template to guide you, okay, for your practice. So, and the more you do, the better. The more you talk, the better for you. Don't hide and be a spectator. Those who participate usually do better than those who just listen. So I wish you all the best, and we shall continue with our online class tomorrow. Thank you all, and good night.
Thank you.
Thank you.
Thank you, sir.